Guys, have you ever noticed a sudden change in your intimate odor and wondered, is this normal? Or maybe you've dismissed it, feeling too embarrassed to talk about it? What if I told you that your body is constantly sending you messages, and odor is one of its most powerful signals? Magnifying glass tilted right, many women feel uncomfortable discussing intimate health, but understanding the changes in vaginal odor is more than just a matter of hygiene. It's a vital part of your overall well-being. Ignoring these signs could mean missing early warnings of an infection, a hormonal imbalance, or even a more serious health condition. Lightbulb, in today's video, we're breaking the silence on this taboo topic and uncovering the truth about what your intimate odor is trying to tell you. You'll learn. White heavy checkmark, what's normal and what's not when it comes to vaginal odor. White heavy checkmark, the top causes of unusual smells and how to fix them. White heavy checkmark, the dangerous mistakes women make that disrupt their intimate health. White heavy checkmark, practical, doctor-approved hygiene tips to keep you fresh, healthy, and confident. Warning, stay with me until the end because this is not just about avoiding embarrassment. It's about protecting your health, understanding your body, and making informed choices that could prevent long-term problems. Hit that subscribe button, and let's dive into this must-know topic. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. The importance of odor, a silent messenger of intimate health. Among the many unspoken aspects of personal well-being, intimate odor stands as an often overlooked yet vital indicator of vaginal health. While the topic may feel taboo or uncomfortable for some, acknowledging its significance can empower women to better understand their bodies, detect early warning signs of imbalance, and take proactive steps toward maintaining optimal hygiene and health. The vagina is a self-cleaning organ, naturally producing secretions that flush out unwanted bacteria, maintain a stable pH level, and support overall reproductive health. As a result, every woman has her own unique, subtle, natural scent, which varies based on factors such as hormonal changes, diet, hydration, and lifestyle habits. This natural fragrance is not a flaw or a problem to be corrected. It is a normal and essential part of being a woman. However, when this mild, musky, or slightly tangy aroma shifts into something pungent, sour, or fishy, it may serve as a warning signal that the body's delicate balance has been disrupted. This is not merely a cosmetic or social issue. Unusual vaginal odor can be a sign of underlying health concerns that require attention. Recognizing the signs of an imbalance. A change in vaginal odor can be triggered by a variety of factors, some of which are minor and easily addressed, while others may indicate a more serious health issue requiring medical intervention. One of the most common causes of strong or unpleasant vaginal odor is bacterial vaginosis, BV, a condition caused by an overgrowth of harmful bacteria in the vagina, which disrupts its natural flora. According to medical research, approximately 1 in 3 women will experience bacterial vaginosis at some point in their lives, making it an extremely common but often misunderstood condition. The telltale sign of BV is a strong, fishy odor that may become more pronounced after sexual intercourse or during menstruation. Other potential causes of unpleasant vaginal odors include wearing synthetic underwear, tight, non-breathable fabrics trap moisture and heat, creating an environment where bacteria and yeast can thrive. Overwashing or using harsh cleansers. While good hygiene is important, excessive washing, especially with scented soaps or douches, can strip away the natural protective bacteria in the vagina, leading to an imbalance. Sweating and heat buildup. Excess perspiration in the groin area, particularly in warm weather or during exercise, can lead to an increase in odor. Hormonal fluctuations. Changes in estrogen levels due to pregnancy, menopause, or birth control can alter vaginal secretions and affect odor. Certain foods and drinks, spicy foods, caffeine, alcohol, and strong-smelling foods like garlic or onions can influence the body's natural scent, including vaginal odor. Sexually transmitted infections, STIs. Conditions such as trichomoniasis, gonorrhea, or chlamydia can cause foul-smelling vaginal discharge, along with itching, burning, or irritation. When to take action: addressing intimate odor with care. If vaginal odor suddenly becomes overpowering, unpleasant, or persistent, it's essential to take action rather than ignore or feel embarrassed about it. This is not just about confidence or self-esteem, it's about health, hygiene, and overall well-being. Here's what you can do. 1. Assess hygiene habits. Switch to breathable cotton underwear, avoid scented feminine products, and use mild, unscented soap only on the external genital area, not inside the vagina. 2. Stay hydrated and eat a balanced diet. Proper hydration and nutrient-rich foods support the body's natural detox processes and can help maintain vaginal health. 3. Monitor for other symptoms. If odor is accompanied by itching, burning, unusual discharge, or pelvic pain, seek medical advice immediately. 4. Pause intimate contact if necessary. If you notice a strong or unpleasant odor before intimacy, it may be best to postpone oral intimacy and have a gentle, understanding conversation with your partner about hygiene and health. Understanding vaginal discharge, a natural indicator of health. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. While odor is an important clue, another major indicator of vaginal health is discharge. Vaginal discharge serves a critical role in keeping the vagina clean, moisturized, and free from infections. In its healthy state, discharge is typically heavy checkmark, clear or milky white. Heavy checkmark, thin and watery or slightly thick. Heavy checkmark, odorless or mildly scented. However, when discharge changes in color, texture, or consistency, it may indicate an underlying infection or imbalance. Some key signs to watch for include thick, clumpy, white discharge, like cottage cheese. This is a classic sign of a yeast infection, candidiasis, often accompanied by intense itching and irritation. Yellow, green, or gray discharge. This could indicate trichomoniasis, an STI that can cause a strong, foul-smelling odor and discomfort. Foamy or frothy discharge, another common sign of trichomoniasis or bacterial imbalance. Discharge with blood outside of menstruation. This could indicate a number of concerns, including hormonal changes, infections, or even cervical health issues, and should be discussed with a healthcare provider. Ignoring abnormal discharge or attempting to mask it with scented products can worsen the underlying issue. Seeking timely medical attention is the best way to ensure that minor infections do not escalate into more serious health problems. Breaking the stigma, encouraging open conversations about intimate health. For too long, topics related to vaginal health, odor, discharge, and hygiene have been whispered about in embarrassment or avoided altogether. This silence has led many women to feel ashamed, anxious, or confused when experiencing changes in their intimate health. But the truth is, vaginal health is just as important as heart health, skin health, or mental health, and it deserves the same level of care, awareness, and discussion. By educating ourselves and others, we can create a culture where women feel empowered rather than embarrassed, and where intimate health is approached with compassion, knowledge, and confidence. Final thoughts: embracing health, confidence, and self-care. Understanding the natural rhythm of your body is an essential part of self-care. Recognizing the subtle changes in odor, discharge, and comfort allows women to stay proactive about their health, prevent complications, and maintain a sense of confidence and well-being. Rather than ignoring or masking the signs our bodies give us, we should learn to listen, adapt, and respond with the care and attention we deserve. Light bulb: remember, a healthy body is not about perfection, but about balance, awareness, and respect for the signals it sends us. When it comes to intimate health, knowledge is not just power, it is freedom. Recognizing signs of irritation and inflammation. When the body speaks, listen carefully. The human body has a remarkable way of communicating discomfort, often through subtle but unmistakable signs. One of the clearest indicators of inadequate hygiene, irritation, or an underlying health concern is redness, inflammation, or persistent discomfort in the intimate area. These symptoms are the body's way of signaling that something is off balance, whether due to an external irritant, a bacterial or fungal infection, or even friction from clothing and hygiene habits. When the delicate skin around the intimate area becomes inflamed, it often burns, itches, or feels sore, making everyday activities uncomfortable or even painful. Sometimes, irritation can be caused by something as seemingly harmless as a new soap, a change in laundry detergent, or prolonged moisture exposure. Other times, it may indicate a deeper issue, such as a yeast infection, bacterial vaginosis, or even an STI. Regardless of the cause, when symptoms like these appear, intimacy should be paused until the issue is resolved. This is not only about physical comfort, but also about respecting the body's natural healing process. Common causes of irritation and inflammation. Understanding the root cause of irritation can help prevent future discomfort and maintain optimal intimate health. Some of the most common triggers include harsh or scented hygiene products. Soaps, bubble baths, and scented wipes contain chemicals that can disrupt the vagina's natural pH balance, leading to irritation. Tight or synthetic underwear. Fabrics like polyester and lace trap heat and moisture, creating an ideal environment for bacteria and yeast to grow. Sweating and friction. Extended periods of sweating, such as after exercise, combined with friction from tight clothing or underwear can cause chafing and irritation. Hormonal fluctuations, menopause, pregnancy, and even stress can alter vaginal pH and reduce natural lubrication, increasing the risk of irritation. Infections. Yeast infections, bacterial vaginosis, and STIs can cause inflammation, redness, and discomfort, often accompanied by unusual discharge or odor. When faced with redness, burning, or pain, the most responsible course of action is to address the problem immediately, rather than pushing through discomfort or avoiding the issue out of embarrassment. A few days of patience and care can prevent long-term complications and ensure that intimacy remains a source of pleasure, not discomfort. Pain in the intimate area, a warning sign that should never be ignored. Pain is the body's alarm system, a call for attention and action. Yet, many women downplay discomfort in their intimate area, assuming it's something they just have to tolerate. This couldn't be further from the truth. Pain in the intimate area is never normal, and whether it manifests as a dull ache, sharp stinging, or burning sensation, it should never be ignored. The causes of intimate pain can vary widely, from temporary irritation to more serious medical conditions. Some of the most common causes include vaginal dryness. As women age, especially after menopause, estrogen levels drop, leading to a loss of natural lubrication. This can cause the vaginal walls to become thin, fragile, and more susceptible to pain during intimacy. Infections. Conditions such as urinary tract infections, UTIs, yeast infections, or bacterial vaginosis can cause a burning sensation, itching, and swelling, making any form of contact uncomfortable. Poor hygiene or excessive washing. While cleanliness is important, overwashing or using harsh soaps can strip the vaginal area of its natural protective barrier, causing dryness, irritation, and pain. Pelvic floor disorders. Some women experience pain due to muscle tension in the pelvic area, which can create a feeling of tightness or discomfort. Sexually transmitted infections, STIs. Certain infections, like chlamydia, gonorrhea, or herpes, can cause pelvic pain, burning, and discomfort during and after intimacy. When experiencing pain, irritation, or swelling, it is always advisable to pause intimacy and seek medical advice if symptoms persist. Ignoring the warning signs will not make the problem go away. It may, in fact, make it worse. Taking care of one's intimate well-being is not only self-care, it is self-respect. Women should never feel ashamed for addressing these concerns with a doctor, nor should they feel pressured to endure pain in silence. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. The power of communication and respect. Creating a healthy dialogue about intimate health. Intimate health is deeply personal, but it is also something that affects both partners in a relationship. That's why open, honest, and judgment-free communication is essential. Bringing up topics like hygiene, discomfort, or infections can feel awkward or even embarrassing. But in a relationship built on trust and understanding, these discussions should be seen as an act of care rather than criticism. A few key things to keep in mind when discussing intimate health with a partner. Heavy checkmark, approach with sensitivity, avoid blame or shame. Instead, frame the conversation around care, health, and mutual well-being. Heavy checkmark, encourage understanding. Many people are simply unaware of the importance of intimate hygiene or the signs of imbalance. A gentle conversation can help educate rather than embarrass. Heavy checkmark, prioritize health over momentary discomfort. While it may feel awkward at first, these conversations can prevent long-term health complications and strengthen the bond between partners. Heavy checkmark, lead with respect and patience. Not everyone will be comfortable discussing intimate health right away. Give your partner space to process the conversation and respond openly. By making health and hygiene a shared responsibility, couples enhance their connection and foster an environment where both partners feel comfortable and cared for. Practical tips for maintaining optimal intimate hygiene. Good intimate health isn't just about avoiding discomfort. It's about feeling fresh, confident, and comfortable in one's body. Whether young or in their golden years, every woman can benefit from incorporating healthy hygiene practices into their daily routine. Here are some medically backed, expert-recommended tips for maintaining excellent intimate health. Avoid scented products. The vagina is self-cleaning, and using scented soaps, douches, or sprays can disturb its natural flora, increasing the risk of infection. Stick to gentle, unscented cleansers. Choose breathable fabrics. Wear cotton underwear and avoid tight-fitting synthetic fabrics that trap moisture and encourage bacterial growth. Practice balanced hygiene. Overwashing can cause dryness and irritation, while underwashing can lead to bacterial buildup. A simple wash with warm water and mild soap once a day is enough. Skip daily liners and wet wipes. While they may seem convenient, frequent use can alter vaginal pH, leading to discomfort and irritation. If necessary, use them only occasionally. Stay hydrated and maintain a healthy diet. Water, probiotics, and a nutrient-rich diet can help maintain a healthy vaginal environment. Schedule regular gynecological checkups, especially after menopause. Regular visits to a gynecologist can help detect issues early and maintain long-term intimate health. Final thoughts. Self-care is self-respect. At the end of the day, intimate health is not just a personal matter. It is a foundation for confidence, comfort, and overall well-being. By staying informed, listening to our bodies, and communicating openly, we create a healthy, supportive space for both ourselves and our partners. Light bulb, your body is speaking to you. Always take the time to listen. Light bulb. Now that we've uncovered the truth about intimate odor and how it serves as a silent messenger of your health, let's reflect. What was your biggest takeaway from this video? Cherry Blossom, did you learn something new about how diet, hygiene habits, or hormonal changes affect your intimate health? Cherry Blossom, are you rethinking how you approach feminine hygiene products or daily habits? Cherry Blossom, or perhaps you've realized the importance of paying closer attention to your body's natural signals. Speech Balloon, let me know in the comments below. What's one thing you've learned today that you will start practicing in your life? Your insights might help someone else who needs this information. If you found this video helpful, please leave a comment below, and don't forget to like, share, and subscribe to our YouTube channel so you never miss out on empowering, health-focused content. Hit the notification bell so you'll be the first to know when we release new videos on health, wellness, and self-care. Thank you for watching, and remember, your body is always speaking to you, so take the time to listen. Sparkling hearts, see you in the next video.